Give a shout out to all these smart people who helped give content to this talk. So many doctors and other leaders at Kaiser Permanente. We can head to the next slide. So the first thing I wanted to mention, we kind of forget about this because we've all sort of grown up with vaccines, but inoculation or vaccination is actually an old practice. It's been around a long time. Inoculation is different than vaccination. Inoculation is intentionally becoming infected with some amount of virus to stimulate a mild infection and actually protect from life-threatening infection. This was first done with smallpox, which thankfully has pretty much been eradicated because it was deadly. Smallpox is terrible, had about a 35% mortality with some outbreaks, which is hard for me to wrap my mind around. And apologies for the background music, that's my kiddos. First documented use of inoculation was in the year 1500 by a Chinese author, Wan Quan. And what they would do is a little bit gross, but they would actually make a powder out of the scab from the smallpox rash and snort it up the nose, and it would cause a mild infection, which doesn't sound so mild. The mild infection actually had about a 1% mortality, but this was much more favorable than, of course, the 35% mortality. Later in the 1700s, we know that many Africans actually practiced inoculation and brought that practice with them when they were kidnapped and brought as slaves to the United States, well, or to the Americas at the time. Early vaccines used live virus to induce immunity, and we do have some live virus vaccines now that we use, such as varicella or chickenpox, but most current vaccines use a dead virus or a portion of a virus to induce an immune response and protect the body. Next slide, please. So we can kind of dive into how the Pfizer and Moderna vaccines work. These slides are very heavy on content because I wanted you to be able to see as much information as I have available, but I'm not going to cover every detail on every slide. So what happens with this, it's called an mRNA vaccine. And the way this works is it's not a live virus. It's not even a dead virus. Imagine it, mRNA is sort of like a little message that goes inside the body and tells the cells to make just one part of SARS-CoV-2, or the coronavirus that we're all adjusting our lives around, one part called the spike protein. So the little mRNA goes to the body, it tells the cells, here's the instructions, make this spike protein, and then the cells start making the spike protein, they start putting it on themselves, and then the whole body reacts and says, hey, you're foreign, and it builds up an immune reaction to that. So what's interesting about this is it can't get you COVID, right? Because it's not a dead or a live virus. And the mRNA just ends up sort of like garbage in the body and doesn't get incorporated into our cells. And so it's never incorporated into the DNA. So pretty smart new technology. Next slide. This is, I think, the really big question lots of us have been asking. How in the heck could we ever develop a vaccine so quickly? You have two timelines here. The first timeline is sort of the typical process that we've come to know for vaccine production. It takes years, usually more than 10, because each step costs a lot of money, and we require that step to be completed before we ever move on to the next one and invest in the next stage. So what we have done in the SARS-CoV-2 vaccine development is keep all those essential critical components, but just really compress the timeline so that, for instance, phase 1, phase 2, phase 3 trials, phase 1 is just, initial safety in usually in animals, and phase 2 is safety in people. Phase 3 is typically efficacy. Will it work? And those trials, as you see on that bottom row, really almost happened in tandem. And then production happened while we were doing phase 3 trials. So before we even knew if these vaccines would work, it was already being produced. And that's how it got made so quickly. Another interesting piece of information that's not included on the slide is that we have scientists who had a ton of information about coronaviruses before this particular coronavirus started attacking us. And that was from the MERS outbreak from several years ago. MERS is also a coronavirus. The corona means crown, right? It's how that the virus sort of looks like it's got a crown around it. And it has, the MERS also has a spike protein. So scientists back in January who had been working on MERS, when they first saw, January of last year, when they first saw the genome of SARS-CoV-2, which is what's causing COVID-19, they said, wow, this looks so much like MERS. We know exactly where to strike. So we basically started way ahead in vaccine production because we already knew where to hit the virus hard and it would be effective. There's a really great podcast about this. NPR did a show, I want to say back in December. It has a funny name. It's called Rock versus Hill. The second part is all about this. It's very interesting. So next slide, please. So this is basically how we could produce something so difficult so quickly. And one comparison is sort of how Kaiser Permanente really accelerated the speed of building ships during World War II. They, with a lot of money and a lot of resources and a lot of motivation, they were able to speed up ship production from years to just days. Another way to think about this is, those home remodel shows, right? Normally it takes like months and months, maybe years to build a home, but home remodel shows have tons of money, lots of helpers and lots of motivation, and they do it in a week. So that's essentially kind of what happened with the vaccine production. Next slide. To speak specifically about the Pfizer vaccine, Moderna is very similar, and I've included some slides here in the appendix that we won't get to, but the Pfizer vaccine is 2 doses. It's given 3 weeks apart. Moderna is also 2 doses, 4 weeks apart. Both doses are necessary for full protection and should not be given with any other vaccine. So no vaccine 14 days prior or 14 days afterwards. Next slide. Things to remember, this is very effective. Now, compare this to a flu vaccine. Most, flu vaccines in a year are like 60% effective, which is actually very helpful for the community. This is dramatically more effective in the range of 90 to 95% for Pfizer and Moderna. And this worked well across ages, across gender, across race and ethnicity demographics. And also we saw the same efficacy in patients over 65, which is important. Things to know, this was not evaluated in children under 12. It was also not evaluated in pregnant or breastfeeding women. Severe reactions were pretty low, although I would say, especially after the second shot, a lot of people have some really mild illness symptoms, maybe about 25% or so. And then for very severe anaphylaxis, which is a life-threatening allergic reaction, this is rare to begin with. In the setting of COVID, it's been found to be quite rare. I know at Kaiser Permanente, our numbers are similar, incredibly low risk of anaphylaxis after vaccination. Next slide, please. So lots of people were enrolled in both trials. Something that I think is important is, in the range of 30 to 37% were racially diverse. So including Black patients, Latinx patients, and also a decent smattering of older adults. Next slide. This is my very favorite slide of the whole presentation. The first time I saw this slide, I actually cried because I knew the vaccine would work. So along the left side going up, you have more cases of COVID, and across the bottom is time, right? So the more time goes by, the red group is the group that had the placebo, meaning the dose with no medication, no mRNA in it. And the blue line is those who actually got the vaccine. So you see at day 7, somewhere between day 7 and day 14, there's a real break in the 2 groups. And the group that is unvaccinated just keeps getting sick over time. whereas the folks who were vaccinated almost instantly, it's almost a horizontal line, which is pretty incredible. So very low caseload for those vaccinated group. The graph for the Moderna vaccine looks very similar, and the reason is they use the exact same technology for both vaccines. Next slide. Side effects are relatively common, mild signs of illness like headache, muscle ache, some people even have a fever, and then definitely some soreness at the arm. I had a lot of those symptoms after my second shot last week. Most of them went away pretty quickly. It's about 25% or so, maybe 25 to 40%, and it's often on day 2. Now, the thing to remember is all those symptoms I mentioned, except for shoulder or arm soreness, all those other symptoms are also COVID symptoms. So definitely if you have them, stay home. In my work, for people who still have symptoms on day 3, then we order a COVID test. And if you have shortness of breath or cough, those are not expected at all after the vaccine. So that's worth a test. Next slide. This has been in the news a lot. We are definitely concerned about the new variants of COVID. The good news is that the vaccines cause a really multi-step immune response in the body, a multi-part reaction to the spike protein. So you'd have to really have a lot of mutations to make the vaccine completely ineffective. Certainly, we're starting to see in some reports that the vaccine may not be as effective as we thought about. I heard one vaccine expert said, well, it started out super awesome, and with some of these mutations, it may just go down to the level of awesome. Either way, vaccination is the strategy that we're going to need to use to really defeat the virus. And so even if they are less efficacious by a small amount, it's still going to be our best strategy. And vaccines can be adjusted over time. Let's do the yellow, red, and green slide, the next one. So lots of questions come up about who can get vaccinated. The red area on the right really is just people who should not be vaccinated, and it's a small group of people. The people who should not be vaccinated are people who have an allergy to COVID vaccine. You're right, most of us won't know that until we do it. Or who have an allergy to something called polyethylene glycol, which is included in the vaccine. This vaccine actually has very few additional parts, like other vaccines sometimes have eggs and other stuff, and so people with egg allergies can't take it. This vaccine is totally different, has very little sort of extra stuff. And polyethylene glycol is in a lot of over-the-counter medications, so generally well tolerated. Let's do the green slide and then we'll move forward. People who can get pregnant if they choose to, people who have immune compromised conditions like cancer, people who are pregnant or breastfeeding, and then people who have allergies of really any type except an allergy to COVID vaccine. Any kind of allergies can go ahead and get vaccinated. If you have a family history of allergies, you can get vaccinated. If you're not sure, ask your doctor. Also, there's a CDC website at the bottom, which is helpful. Next slide. I'm an OBGYN, so this is special interest for me. COVID-19 was not studied on pregnant and breastfeeding women, despite a lot of advocacy to try to get pregnant and breastfeeding women included. Several vaccines are routinely recommended in pregnancy, such as flu and whooping cough. Most vaccines are safe in breastfeeding. Truly, the risk of COVID-19 in pregnancy is higher compared to non-pregnant women. They're twice as likely to get admitted to the hospital and ICU, actually have a higher mortality rate. So for people who can't social distance, most experts in the United States are still recommending, strongly considering getting vaccinated in pregnancy. And I recommend all my patients to at least have a conversation thinking about their risk. Next slide. So to sum up, vaccine protects the person getting vaccinated. We don't yet know for sure if it prevents transmission. So once you are vaccinated, it is really important to just not change your behavior, right? Keep wearing your mask, watch your distance, wash your hands. You know, I had my second dose last week. My parents are getting vaccinated this week, and they're asking, okay, cool, what can we do? How can we open up? And it's like, nope, we're doing everything the same. So we're going to keep our masks on and keep our distance and really limit our interaction with others. I'm doing all that same stuff at work. So I encourage you to do the same. Next slide. And then also, this has been a really slow, painful, frustrating process. It's going to require a lot of patience on our part. We have a ton of Californians over age 65, about 6 million. When I put this slide together about 10 days ago, we had less than half of that amount of vaccine from which we were vaccinating healthcare workers, nursing home residents. So some of our healthcare institutions, including Kaiser Permanente, are really focusing on 75-year-olds and older, and really doing it by risk assessment. Next slide. I see a question in the chat. Can I clarify which mental health care workers are eligible for vaccination? Hard to say. Through Kaiser Permanente, really any of our employees, whether they are patient-facing or not, are eligible for vaccination. So I think this may depend a little bit on where you work. And then I just included some pictures here of some vaccination heroes. These are some of the first folks in the country to be vaccinated. Sandra Lindsay is an ICU nurse in New York, first person in the United States. And then Helen Cordova, ICU nurse down in Los Angeles, first person vaccinated in California. And then next slide, I included some pictures of those of us who've been vaccinated. So there's Susan and Orvan. I've got my picture up there. And then some other pics from different Kaiser physicians and staff. So it is true that Kaiser has short supply, like every place. In fact, I was told this week that Kaiser Permanente actually had to cancel some appointments, which is pretty disappointing. But we are getting new vaccine, I understand, every week. I'll go ahead and conclude there. Really great to be able to talk with you. And then Adriana, I'll defer to you if there's time for questions.
Yeah, I think there are a few more questions in the chat. I'm just going to read them out loud. How is Kaiser working with community groups that serve people of color and immigrants most impacted by COVID?
That's an excellent question. I don't know the particular vaccination strategy beyond the fact that I know we're focusing on healthcare workers and those who are 75 and older. I don't know what the risk stratification is for those who are Kaiser members. And then I don't think that they are directly working with different community organizations. I think those community organizations are getting supply through the county.
All right. Do people who have already had COVID have any difference in severity or type of reaction to the vaccine?
Not that I know of. And the recommendation currently is that if you've had COVID, still recommended to get vaccinated. Usually the recommendation is to wait 12 weeks.
What is the mRNA derived from, considering it's not from SARS-CoV-2 technology? Is it all artificial or are there organic components of, if so, which ones?
That is an excellent question, and I do not know the answer.
You addressed the mental health care workers one. Are there efforts being made to help educate the general public like we are right now? I know there's a lot of misinformation and confusion and people are unwilling or unable to do their own research. So how do we educate them? Good question.
Oh, yes. Well, that is why I'm here. This is something that's, of course, really, really critical. And now all of you can be, the people who have good knowledge, right? Who have up-to-date good knowledge, and you can be a trusted resource for your community. That's really why I wanted to be here. We are working internally to really educate our staff and physicians to make them feel comfortable, first of all, getting vaccinated, not to make them, but to help them, right? No one's being forced to be vaccinated right now. And then also to have those conversations with our patients.
Adriana, maybe 2 more questions.
Okay.
There's a language access question.
What was that? Access?
Yeah. Can you have this information? Do you have this information in Spanish, Carrie?
I do not have this information in Spanish. Susan has a copy of the slide, so happy to share.
Okay. Our staff are able to get the vaccine. I'm struggling with motivation due to some fears. We are extremely high risk. Will we be able to share this information with our agencies? So the slides will be made.
Absolutely.
The slides will be made available to everybody. We'll share them now, later in the shared drive. So they'll be made available to everybody. Last one.
BIPOC, high risk BIPOC question.
Yes. Did Kaiser give priority to high risk Black, Indigenous, people of color, older adults who are at higher risk?
I don't know what algorithm they're using for our 75-year-olds and older. I think that they've included some information about high-risk groups according to, ethnic and racial demographics. I hope so, given what we know about risk. But I believe so. I just don't have access to that information myself.
All right, if you have any other questions for Dr. Watson, just feel free to drop them in the chat. And thank you, Dr. Watson. If you can share your information in the chat so people can reach out to you at some point if they have further questions, that would be great. Thank you again. We're gonna move on to
My pleasure.
Thank you. Our next presenter, he's our new Chief Equity Officer, Gilbert Salinas. Are you on?
I am on, yes.
Awesome. Just a reminder for everybody, if you have questions during the presentation, make sure to drop them in the chat and we will try to get to them towards the end. Gilbert, you also have 15 minutes, but I'll give you a little grace period and we'll have time for some questions after.
Sounds great. Thank you, Adriana. And thank you, Dr. Watson. Great presentation. I just wanted to thank everyone for having me this morning. Our distribution plan, where and how to get vaccinated, and talk a little bit about equity in terms of our goals for equity. So to be heavily based on that. So COVID-19, I'll be sharing with you the broad picture and data numbers across Contra Costa County. COVID-19 vaccine timeline, we'll talk about a lot in our timeline. Vaccine allocations, I'll talk a bit about our allocations committee. And where to get good information from, some of the links and self-advocacy information. And we'll end it with a little bit of prevention. So just to give you the broad landscape of where we're at, today we are, obviously all of you, or most of you should know that we are have exited the regional order effective 1/25 of 2021, which is great news. Businesses are starting to open up a bit more, and this is all based on all of the hard work of really all of the community and everyone across Contra Costa really staying at home and abiding by some of these orders. We have been able to save thousands of lives by doing so. Our positivity rate for the 7-day average is 9.0. This number was above 13% at one point. It's now slowly starting to creep back downward. So we're seeing less cases ICU, which is great news for us. Next slide, please. In terms, close to 130,000 vaccines, 11.4% of all Contra Costa residents 16 and older have received their first dose. Started, I want to say about a month ago, we were only at like 1%. And so we really arms. And so we are doing an excellent job in terms of getting the vaccine out. Next slide, please. First iteration of data that's on our dashboard, on our website, we have a dashboard. Our dashboard really speaks to tiers that went out. The first tiers, which included healthcare workers, which I'll talk a bit about more in the next slide. And so the first iteration of data captures a lot of that first phase 1A, but we'll talk a bit more about that. Our vaccine allocations committee really started as soon as we got the vaccines in our hands. As these things happen, they happen real fast. It's like one day to the next. you're getting vaccines. We developed a vaccine allocation committee very early on, and the goal for this committee was really to make sure that we had a fair and transparent evidence-based approach to distributing the vaccine. We are one of the only counties, or one of the few counties in the country that are tracking race and ethnicity data, and it is on our dashboard. And we did that on purpose, by design. Even if the numbers were not going to look great, even the data was going to point to us saying that we were not hitting our targets on ethnicity and race, we wanted to know that so that we could improve. And so early on, we embedded these things into our process. We did create partnerships. We have partnerships with Lifelong, La Clinica, Kaiser, Sutter, John Muir, and CCHP. We also have pharmacy partners to vaccinate vulnerable populations, Medical Reserve Corps, Emergency Medical Services, and all of you are partners as well. We heavily rely on presentations like this and on all of you to really spread the word on the importance of getting vaccinated. Next slide, please. This speaks a little to our tiers. You know, we have a very strong goal of reaching 1 million lives by July 4th. We want to vaccinate 1 million people by July 4th. That's our goal. It's our vision, our plan. Obviously, with all of our community partners, the John Muirs and the Kaisers in the area, really to build out a coalition of this mission that we're heading towards. As we think about the first iteration of folks getting vaccinated in phase 1A, tier 1, this is all of acute care, psychiatrists, correctional facility, hospital staff, residents and staff at skilled nursing facilities for older medically vulnerable individuals, paramedics, CMTs, dialysis centers. And you know, and this obviously is what points to the data that you're seeing now, the data that's folks, majority of our folks that are working in healthcare, you know, showed up on our data. And so that's what you're seeing right now. We are moving to having folks that are 65 and 74 request appointments for vaccination. That is open on our HS website, but we also have a call center that's available for folks that can't access computers or might not be able to navigate the website. That number is 1-833-829-2626, and they're open from 8 a.m. to 8 p.m. I'll share this information with Susan so she can distribute as well. We will also continue to prioritize in phase 1A. You know, we still want to continue to prioritize phase people 75 and older to make sure that we are able to reach them as well. And I will definitely add the phone number to the chat. Thank you, Susan Mayer. Those who are 65 and 74 for this round, we are looking at prioritizing based on race, ethnicity, and location in order to support equitable distribution for the vaccine. And there's ways to do this, really looking at zip codes, knowing where folks live, really based on the race and identity, where we can really target a targeted approach to reach these communities. That's our goal for the next round of efforts. We are going to be very targeted and pointed, and we want to be based on this next round. And so we are the phase 1B group, more capacity within the county. One of the main issues, as you heard from Dr. Watson as well, we don't have a lot of vaccine. So we're just, all the vaccine we're getting, we're putting it in arms, but we really need more vaccines. So we will work on some of that as well. Next slide, please. When we think about our vaccine distribution plan, We have to partner with non-traditional partnerships. This is really utilizing our mobile clinics to reach out to communities. For one example is a housing authority, school districts, faith-based communities, farm worker communities, and community-based organizations. And obviously we are already working with our community partner clinics, and CCRMC and our clinics are doing amazing work at facilitating this at scale. Between the scale, because we do have multi-county health systems that are already vaccinating folks. We have other healthcare providers in the community. We have doctors' offices, pharmacies. The fire department has established vaccination sites and special events that we're putting together for in terms of mobile clinics. And so now that we have all of these in place, we really are adding another to reach our equity targets. Mobile clinics. Now, the mobile clinics, they are not set up for huge throughput, so they're not mass vaccination sites, but they have a running list that we are looking at now of senior housing or low-income housing based on specific zip codes in the hardest hit communities. And what we're doing is really working with the housing authority on this. They provide us a list of folks that need send a mobile team out, and we go in there and vaccinate. We are doing this with senior housing. We are starting the process of working with some of the farms in East County as well. And so this is one of the ways that we're addressing some of the hard to reach areas. We also have established partnerships with all the Safeways and Lucky pharmacies. So even if folks don't shop there, they can go to the parking lot, go straight to the pharmacy, get their vaccination there. And that's something that's available to our community as well. So we have to be very creative with our dosing. So that speaks to a bit about the equity question. And I'll be happy to answer more questions. We also have a large scale operation happening for precision folks, calling them directly, asking them to get vaccinated. We have all these partnerships established. And the huge part of it is also being on this presentation and call today, working with all of you. You are all the partners that can help us spread the word, that can reach our communities and bring back information that you feel we need to help work on with you in partnership. Because ultimately, it should be everyone's goal to get everyone vaccinated. That's how we will save lives. That's how we will continue with this next level of the battle with COVID-19. Only in partnership. That's the only way this is going to work. It's not going to work if folks are not involved or not really pushing this information out to communities and encouraging folks to get vaccinated. That's our main purpose. That's our objective. And so I hope you will all join me on that. Next slide, please. And the website. Well, Susan has this presentation, so she can make sure to distribute it to you. It has the information and what our website looks like when you click on there. We also have on there a list of all the sites that are spread throughout the county. It's a long list. If you have issues with appointments, feel free to reach out to our team. We can help with that. And we also want to encourage folks to help anyone that you know of that can't really access computers or need to support. And we want to encourage that. I want to encourage you to reach out to your neighbors, reach out to your friends and families that do church groups, prayer lines, and any methods that you can to really spread the word. I know in our Latinx community, corre la voz, right? Like the voice carries it. And so really put it out there. let people know that there is help and support for them. Next slide, please. And I just want to thank all of our community-based organizations, all of you on this line. These are just some of our partners that are working with us. This is just a snapshot of what it looks like if you go onto their patient portals and their websites in terms of starting to facilitate vaccination. Next slide, please. We also, and this is another snapshot of, John Mears, for example, if you want to log in and receive your, this is just a snapshot of what it looks like. Want to make sure that you're aware that all this information is on all of our partners' websites. Next slide, please. And thank you to all of our partners. We have long history of our partnerships. We have a partnership with CVS, John Muir, Rite Aid, Safeway, CAL FIRE, La Clínica, Kaiser Permanente, Lifelong Medical Care. All these organizations, and of course, all of you are really our partners in this to vaccinate folks across the county and help us reach our target of 1 million folks by July 4th. Every day matters, every place matters, and everyone must do their part. We are still encouraging folks to get tested as well, to safe distance, just like Dr. Watson said, to practice social distancing, washing of your hands, masking up whenever you're in public. Just because you get vaccinated does not mean you cannot catch the virus and infect others. So you do have to, you can still be a carrier. So you still have to do these things as long as we have to, just to keep everyone safe. And with that, I would like to thank all of you. I know these are difficult times, emotional times. I've been involved with this work for a very long time as well. And I know how brutal it is. I know how devastating it has been to communities. So in partnership, I am here with you to work with all of you to try to improve whatever it is that we need to improve on and move forward with the next round of battling with COVID-19. Thank you very much.
Thank you so much, Gilbert. You are exactly at 15 minutes, so we have time for questions. I just want to thank you also. I'm with John Muir Health, and I want to thank you for your partnership. Our mobile clinic is actually out vaccinating today, and we were calling patients yesterday, and some of them said that they had gotten vaccinated through the county, and those who weren't able to, we're trying to get them in. So I want to thank you for your partnership in that.
Thank you. Thank you. I'm glad that you were able to do that. I know we just had conversations with you all, and it happened real fast, right? We talked last week, and this week we're on.
Well, not with me, but somebody in my team you did.
Yeah. Dr. Nat and his team.
Yeah, Dr. Nat's out there today.
We are getting the vaccines out. So we said, whatever you need from us, just let us know. We'll get you the vaccines. Go to the monument, go to East County, go to West County, just get it out there, and so we thank all of you for your support, Adriana and John Muir.
Of course, thank you. So we have some great questions in the chat. If you can share the zip codes that are targeted based on race and ethnic criteria.
Yeah, we can definitely do that. And just to give you an overview, it's the hardest hit communities. So the zip codes that have, the hardest hit communities that have been where there's COVID-19 has been the most prevalent and has had the most devastating effects. So I can definitely share that information.
Wonderful. We have some people mentioning that they want their site to become a vaccine location. How would they go about doing that?
So you can reach out to, I have my team on the call too, our team, or my awesome colleagues, Miriam and Shannon Moulton, Shannon Ladner Beasley, and our community engagement team, reach out to one of us. We're targeting this information. We're trying to filter it. There's been so many requests. The first thing I want to say is that folks should go to a site that's already established. That would be the first thing I would say to everyone. Mobile clinics, they can't manage the large capacity, but we do want to establish these sites. Just so you know, we have a long running list right now that we've already put together. We're looking at finalizing the vaccination for that list within the next several weeks. And so, yes, if you have sites you would like to partner with us on, I would even take it a step further. If you have a list of individuals that need appointments that cannot get them online, that are living in our communities of color, get us the names of those folks. If they can access any Lucky's, any Rite Aids, any Safeway, we can hold appointments for folks. So we can start a targeted, very targeted approach. We're serious about being targeted. We will hold those slots for them, so they don't have to, wait because these slots get taken up within hours, and sometimes a few hours. And so, we want to be very targeted. So we want to open up that door.
So we have a lot of questions, so we got to go a little bit quicker. Okay, so one question is, what about homebound seniors who cannot drive to a site? Do you have any plans for that?
Yeah, we just started talking a bit about that. We don't have any plans that I'm aware of at this time, but I know that this conversation has come up in our with our disability community, with our frail elders. And so we are having these discussions on how we can do that. Maybe it's through our mobile clinics as well.
John Muir is having discussions this week with County Connections on how to provide transportation to individuals who are not able to transport themselves. So I will report back on that as soon as that conversation happens.
And there's also a question about the homeless community, but I think we are going to skip over the question. I'm sure you've all thought about it. One question is, are these vaccinations limited to Contra Costa residents?
So if they're limited to Contra Costa residents, our vaccination efforts are here for Contra Costa. Yes, these are for Contra Costa residents. But if folks, maybe some folks are healthcare workers and they work here but they don't live here, that means, and so they can get their vaccine actually here.
Okay, it says must live or work in Contra Costa. Jill Ray, thank you. So, there are lots of more questions and a lot of engagement in the chat box. So Gilbert, I would encourage you to go through the chats. We're gonna grab these messages as well.
Okay.
We do need to go over to our third speaker, but thank you so much.
Thank you. Thanks all of you.
Thank you. Oh, tu nombre es Gilberto. I've been calling you Gilbert. Gilberto,
You
muchas
call me
gracias.
whatever you want. You call me Gil, Gilberto, or Gilbert.
If you could just share your information in the chat, that would be great. Just share your information, and then I don't know if you want to answer people privately, that would help as well.
Yeah,
or publicly. No, so everybody can see the answers publicly. Thank you again.
Thank you.